All right, so continuing on with identifying different parts of the body. So again, in health science, we have that common language. So we're going to talk about body cavities, planes, and different types of regions in the body. So looking at this picture here, we can see some basic cavities. We have letter A is up in the skull here. This is known as the cranial cavity. And the major organ inside of the cranial cavity would be the brain. If we go to letter B, B is over here. And remember, we have to refer to the left or right side of the patient. So this would actually be the right side of the patient. We would call this the right pleural cavity. So the right pleural cavity would house the right lung. C, in the middle here of the chest, is the pericardial cavity. Peri means to surround something. Cardial is referring to the heart. So the pericardial cavity surrounds the heart. Over here, D is on the left side of the body, and this houses the left lung. This is the left pleural cavity. E is the mediastinum. Some pronounce it mediastinum. F is the abdominal cavity, sometimes also called the peritoneal cavity. And G is the pelvic cavity. H is the spinal cavity, which houses the spinal cord, and I is the entire thoracic cavity. And you can see from the front view, the thoracic cavity is actually divided into 4 separate cavities. But if we call the entire chest cavity, that would be the thoracic cavity. The different body planes here, we have the sagittal plane. Sagittal separates left from right. If it goes directly down the center, we would call it the mid-sagittal, but any sagittal plane would separate the left from the right. The frontal is also known as the coronal plane, separates the front of the body from the back of the body. And this is a transverse plane. So we talk about these planes when making cuts in surgery. We also talk about the planes when looking at radiographs or different types of imaging. We can cut into the body in certain ways doing that imaging and have different cuts or planes that we're looking at. So again, sagittal is left from right, coronal or frontal is front from back, and transverse would be top from bottom or superior from inferior. Then we refer to the abdominal quadrants and regions, and abdominal quadrants are a lot more commonly used in the healthcare field. The abdominal regions are primarily used by anatomists or people that specialize in studying anatomy, and we're only referring to the abdominal organs. So just to kind of point out what some of the organs here that you're looking at, up here in the thoracic cavity is going to be the right lung, the heart, and the left lung. Those are not included in the abdominal quadrants. This right here is the diaphragm. And the diaphragm completely closes off the abdominal cavity from the thoracic cavity. So when we're talking about the abdominal quadrants, we're only talking about the stuff down in the abdomen, not up in the thoracic cavity. This big organ is the liver. It's on the right-hand side of the body. Underneath it is the gallbladder. On the left-hand side of the body, we can see this big sac, which is the stomach. Tucked in behind the ribs here would be the spleen. Underneath the stomach is the pancreas. And then you can see the small intestine in the center here. The large intestine goes up, across, down, and then it squiggles to the rectum and anus. In the center here is the urinary bladder, and then the appendix sticks off of this part of the large intestine. And this larger part of the intestine is known as the cecum, so the appendix kind of sticks off of the cecum here. Since this is the right side of the body, and this is the upper region, this is the right upper quadrant. On your study guide, you should be familiar with which organs you would see in the right upper quadrant, so you can write those down based on what I just went over. This is the left side of the body, and it's the upper part, so this is the left upper quadrant. This is, again, the right side of the body, and it's lower, so this would be called the right lower quadrant. And this is the left side of the body, and it's lower, so this is the left lower quadrant. Sometimes these are abbreviated by the first letter of each one of those words. So the right upper quadrant would be called RUQ, the left upper quadrant LUQ, the right lower quadrant RLQ, and the left lower quadrant LLQ. These are the abdominal regions, and you can see the same kind of organ layout here. Additionally, you can mention the kidneys. The kidneys are found on behind the large intestine in these two areas here. But we'll start with the right side, the right upper side here, and this is the right hypochondriac region. In the middle would be the epigastric. Epi means on top of, and gastric is talking about the stomach, so on the surface of the stomach, epigastric. And then here is hypochondriac, the left hypochondriac region. Down here in the middle, we have the right lumbar. In the center, the umbilical. On the left-hand side is the left lumbar. Then we have the iliac region. So this is the right iliac. In the middle, we have the hypogastric. Hypo means underneath or less than, so that's underneath the stomach or below the stomach, so hypogastric region. And then we have the left iliac. We also have various body regions that we give generalized names to. So nasal is what we refer to the nose region. Oral would be the mouth region. Cervical is the neck region. Acromial is talking about the shoulder blade region. Axillary, armpit region. Brachial is the upper arm region. Antebrachial is the forearm. Pelvic would be the pelvic region where we have the genitalia and reproductive organs. And the urinary bladder is also in the pelvic region. Carpal refers to the wrist. Pollex is the thumb. Palmar is the palm of the hands. Digital is talking about the fingers. Pubic is part of the pelvic region, but it's specific to the external genitalia where hair would typically cover the pubic region. Patellar is the knee. Pedal is the foot. Tarsal is the ankle. Frontal would be the forehead. Orbital is around the eyes. Buccal would be inside of the cheeks. Mental is the chin. Zygomatic is talking about the cheeks. Sternal is the breastbone. Thoracic is the chest cavity or the chest area. Mammary is talking about where the mammary glands are. Umbilical is around the belly button. Inguinal would be in the groin area and the lower right and left sides underneath the abdomen, right before you get to the pubic area. Femoral is talking about the upper thigh. Otic is the ear. Calcaneal is the heel. Cephalic is the back of the head. Dorsal is the back of the torso. Gluteal is the butt. Lumbar is the lower back. Occipital is the back of the skull. Olecranal or olecranal is talking about the elbow, so the back of the elbow. Plantar is the bottom of the foot. Sacral would be the tailbone. And vertebral is referring to where the vertebrae lie in the back. So when a patient comes in with a wound, we would say, abrasion to the left plantar region, and they would know right away that it's talking about the bottom of the left foot. So using these terms helps people know where injuries have occurred and take medical notes on the patient.